listening to the Pharmacy Podcast Network.
Improving lives and elevating performance is at the heart of everything Shields Health Solutions does as one of the largest integrated specialty pharmacies in the nation. The Shields team dedicates their patient support programs, experiences, and data platforms to help reduce costs, achieve better clinical outcomes, and accelerate system-wide growth. This is the Shields Health Solutions Special Podcast Series.
Hey, we're going to be talking about specialty pharmacy treatments which fall in line with the conditions around HIV and how we have had ongoing podcast content about HIV treatment over the years. Shout out to Michelle Sherman, known as the Conscious Pharmacist and the Conscious Pharmacist podcast. Done a lot of work and research on HIV. This is a treatment and a condition that continues to get updated, and we appreciate the updates from a team of pharmacists that we've been really leveraging and utilizing lately on the Pharmacy Podcast Network. They've helped us put together a 4-part series welcoming back Dr. Jennifer Donovan with Shields Health Solutions. Jen, it's great to have you back.
Hey, Todd, good to be here.
Subject of HIV, and you have brought fellow soldiers with you as part of the Shields Health Solutions team and protecting and advocating for your patients. Introduce us to our guest from Shields Health Solutions.
Yeah, I have the privilege to be here with Adaolisa. She's one of our clinical pharmacists and has a tremendous amount of experience and expertise within HIV. Prior to her role at Shields, she's worked in different settings and seen really the continuum of care for these patients. So really excited for her to be here and share what she does with our and for our patients.
Thank you for having me, Jen. Thank you. Glad to be here.
Adaolisa, right out, let's dive into a little bit of your background. Why'd you want to become a pharmacist? And what is it about HIV treatment, HIV care that really piques your interest?
Yeah, so I discovered that I wanted to be a pharmacist. It's actually more of a personal reason around growing in Nigeria, actually. In my childhood and seeing how the lack of quality care affected family members. For example, a lot of them were very much interested in taking their medications the way it was prescribed, but there wasn't really anyone there to guide them around that therapy. And because of that, it caused a lot of issues with their health, complications and around that. So for me, just witnessing that firsthand actually pushed me to take on that interest in pharmacy. And because it puts me close to people that are taking medications and being treated for their conditions, and just being present to guide them and just make sure that it's safe as well as working for them. That actually propelled me to choose this career in pharmacy.
So there were an estimated 39 million people living with HIV at the end of 2022, 2/3 of whom, which would have been 25.6 million, are in the World Health Organization's African region, is the way that they have this map, which you can find more of this information at who.int/newsroom. And they do have a graph there. But I bring that up because I was thinking when I first heard of this in the late 80s, a teenager, but born a child of the 70s, 80s, AIDS was HIV. It was a death sentence. We didn't have the type of treatment that we do today and the expertise that we have today from nurses, from physicians, from obviously our pharmacists. So I want to hear from the both of you. I'm going to start out with Jen about the evolution of HIV care and patient treatment and where specialty pharmacy intersects with that.
Yeah, I know it was definitely a death sentence those many years ago, and such a stigma associated with it that hasn't truly gone away as well. I think it's something that many people living with HIV still deal with. But to your point, there was at a time in the beginning where there was nothing, and we've evolved where there's multiple regimens available. We've also been able to address, resistance and have medications to address that. And these medications are now allowing patients to live longer, healthier lives. And in many instances, folks aren't dying of AIDS, but rather of other chronic conditions. And it's really a tribute to the research and available medications. And I know Adaolisa has seen this with our patients. So Adaolisa, any thoughts, from your experience?
Yes, I agree. In the past, how HIV was determined to be a death sentence, but it's not the case today. But then it's still that whole mindset still persists in some populations. And even recently, I did speak with one of our patients that prior to joining our pharmacy, she was under that impression that HIV was a death sentence, and for a very long time she had that diagnosis, but she ignored the diagnosis until she landed in the hospital from complications of the virus. So I say this because while therapy is different today, we're able to treat patients with HIV so that they can live longer, healthier lives. There still remains that I would say there still remains that impression in particular populations that still don't know that they are able to have treatments that work, and that when they take the medications as prescribed, then they are able to live long, healthy lives. And just being in this position as a pharmacist at Shields and coming across patients like that, being able to have that conversation in detail with them to let them know that when they take this medication, that they will get better. It's something that it just I'm overwhelmed just knowing that it still persists in some populations as well.
Yeah, Adaolisa, it's a good call out, and I recall you sharing this patient story with me a few months ago. And yes, I think what stood out to me was this patient was living and suffering with this condition, and probably had a lot of fear associated with it, so much so that the complications led to a hospital admission. And I think what you really underscored here is the need for continued education. Although we've come such a long way with available treatments, we still haven't penetrated some key groups. And I think, Black and African Americans in particular have a mistrust of healthcare. And I think there's still some work that needs to be done to educate and advocate and get, care that's desperately needed for these groups.
Something that stood out to me as the other conversations as part of this 4-part series, which is brought to us by Shields and the whole Health Solutions team, which has been wonderful to be part of this, is your data that you're extracting in order to know and navigate improvements to treatments. And I think this is bigger than Shields. This is other specialty pharmacies. This is health systems. This is payers. 93% average of your patients who reach viral suppression. So you're sustaining and making people be able to live full lives and be able to live with HIV. Talk to us a little bit about the metrics and the feedback that you've received from patients that you've helped, and just shout outs to your team as well about achieving such a high level. That's just amazing.
Yeah, I'll certainly take some of the introductory components. So, as you mentioned, the viral load suppression. So, just to level set here, we want to be able to suppress or not detect the HIV virus in a patient's blood. And so, when it's undetectable, it's a good indicator that the medication is working and able to allow the patient to live a healthier life and also decrease the chance of that person transmitting it to other people. So it's a very positive indicator. And so 93% of our patients have undetectable levels, which is incredible. And when we put this into reference, there's two benchmarks that come into play. One is from the CDC, and the national average, according to the CDC, is about 64, 65% of patients reported by the CDC achieve this viral suppression, which is significantly lower than our 93. And then the second benchmark is the Ryan White, which is considered some of the gold standard in clinics being able to provide treatment and care for patients. And their benchmark is around 90%. So again, we're still exceeding some of the key benchmarks. And I think that's related to the number and frequency of engagements our patients have with our pharmacist. And I would maybe turn it over to Adaolisa to maybe share some of those experiences that really lead to this result.
Yeah, so here at Shields, we spend time with our patients. Initially, when they are introduced to us by our liaisons, we place that call the first time to speak with them, and we try to connect with our patients at a very deep level. We ask them various questions, and we understand, HIV, especially with the history, the stigma. Some of our patients are initially not open to having discussions with us, but just based on, our culture of kindness and being able to just have that conversation with them in a non-judgmental way, just to get to know them. Sometimes it's not just about the drug initially. We ask them questions around their perception about their diagnosis, what they think about the therapy, trying to gauge if they're going to take it, if there are any barriers as well. So we're trying to see if, there are things around the social determinants of health, if there's any barrier at all that is going to keep them from taking their medications. So we're having this discussion with them, and we take that time to build that bond with them. And the moment that they open up to even share any challenge at all, and we're able to help them address it, and also follow up frequently with our patients, then they begin to connect with us and even call us if there are any issues at all. And we're constantly monitoring, right? So like Jen mentioned, in terms of the outcomes, so the goal would be that they have undetectable viral load. But in addition to that, we also want their immune system to recuperate. So the CD4 count is something we also check. So in that initial call, we give them these informations based on if they take their medication just like it's prescribed without missing any dose at all, then they will achieve that goal. We talk to them about the possibilities of what they could do when they take their medications. Like, for example, undetectable status means untransmissible, right? So they are aware that if they finally become undetectable, then the fears around the stigma, which some of them are already going through personally, those things will not hold them back anymore. So just that bond that we create initially and frequently calling them back and checking in on them is what really I feel makes the Shields model different and unique. So for example, is one of our patients, right? I remember calling her because she actually requested to speak with a pharmacist because she wanted to find out more information about a medication that she was taking. So I gave her a call, and she told me, she's trying to, she spoke with her nutritionist, and they flagged a particular medication to call the pharmacist and see if there's any drug interaction. But in the process, I also saw that in her, we have access to the EMR, right? So we're able to see some of our patients, their labs. I could see that she wasn't quite there in terms of the goals, the outcomes, and she's been on the therapy for a while. So in addition to helping her with the drug interaction questions that she was asking about, I did ask her about what she felt about her medication around the HIV therapy, if she was taking it daily. And she opened up to me, telling me about her challenges, with family. She's the primary person taking care of her children, and for the most part, she spends most times just focusing on them, and she's not really thinking about her own health, right? So we had that conversation, and I expressed understanding to her, and also told her that, discussed with her the importance of being adherent to her medication. But then she also expressed to me about constantly feeling sick. And it was around the time that we were just coming out of the pandemic. So she had tested herself multiple times for COVID, and it always came back negative. And so for her, she thought, if I don't have COVID, I'm okay. But she kept on having these flu-like symptoms. At the time, I could see that her CD4 count was very low. So I asked her if she was taking a particular antibiotic that I saw that the doctor had also prescribed for her in the past. And, she told me that she wasn't, because she just stopped getting the refill. So she assumed that she wasn't on the therapy anymore. So I told her that generally that it was important for her to be on that medication, but I would send a message to the doctor, and we did, and we were able to get the refills for her. And basically, my point is that in cases like this, where a patient's CD4 count is low, for example, just being present to see whether the patient is taking antibiotics to prevent any complications or infections that can potentially put them in the hospital is important as well, because we're able to see that in addition to helping her with her adherence concerns, these were all the things that I was able to do in that instant, and place her on that antibiotic so that she can continue to take it and not become so sick that she ends up in the hospital